Hello, good day CI. My name is Christian Maidendoy from BSN Level 1D, and this is my return demonstration for the nose, mouth, and sinuses assessment. Before I enter my patient's room, I already wash my hand, and then after that, I will provide a privacy. Good day, sir. My name is Christian Maidendoy. I'm your student nurse for today. May I know your name, sir?
I'm Ivan Ravi Cabanan.
Okay, how may I address you, sir?
Just call me Ivan.
Okay, Mr. Ivan, for today, we're going to have a nose, mouth, and sinuses assessment. The purpose of the mouth, throat examination helps us to detect abnormalities of your lips, gums, teeth, oral mucosa, and tonsils. And the nose and sinuses examination assists us to detect of deviated septums, patency of the nose, and nasopharynx, and detection of sinus infection. So for today, sir, I'm going to assess first your nose and sinuses. So is it okay for you if I start now?
Do what you must.
There you go. Sir, before we start the assessment, I have a couple of questions for you. Is it okay for you to answer?
It's okay for me.
Okay, my first question is, do you have any allergies?
No.
Okay, difficulty of breathing through your nose?
No.
Sinus infection?
Sometimes.
Injuries to the nose and face?
No.
Okay. Nosebleed and changes of smell?
No.
Do you smoke or chew tobacco? Okay, very nice, sir. So now, Mr. Ivan, I'm going to start the assessment. But before that, I will first put some alcohol in my hands before I'll touch and inspect your nose and face. So first, sir, I'm going to inspect the external nose for any deviation in shape, size, or color, and flaring and discharges from the nasary. So I'm going to put a gloves first before I inspect. Is it okay for you if I'll touch some part of your face, sir?
It's okay.
There you go. Okay, now, sir, I'm going to start inspecting your external nose with. I'm going to touch now your nose and face, some part of your face. Is it okay?
It's okay.
Okay. Can you? Okay, sir. And the finding is that the external nose is asymmetry and straight, no drainage is detected or flaring, and it is uniform in color. Next, sir, is I'm going to lightly palpate the external nose to detect any, determine any area of tenderness, masses, and displacement of bone and cartilage. So I'm going to touch your face, sir. Is it okay? Okay. Can you tell me if you feel any tenderness or pain while I'm touching your face? Do you feel any tenderness, sir? Okay. How about that? No. One. No.
No.
One.
No.
Okay. Very nice. So, the finding is that your external nose is not tender and no process of any liaison or presence of liaison that is in your external nose. Next, sir, is I'm going to determine the patency of both your nasal cavity. So I'm going to start without a glove so that I can feel the air coming out from your nose. Okay. Can you breathe? Go. So the finding, sir, is that the air moves freely as you breathe through your diaphragms. Next, sir, is I'm going to inspect your nasal cavity using a pen light. And then, is it okay for you, sir, if I ask you to tilt your head a little to the left?
It's okay.
Okay, because I'm going to observe for the presence of redness, swelling, growth, and discharge in your nose, inside your nose, and inspect nasal septum between the nasal chamber. So I'm going to start now, sir. Your head, sir. Okay, I'm going to turn on my pen light and start inspecting your nose. I will occlude. Okay. And then can you tell to the right, sir? Okay, very nice. The finding, sir, is that your mucosa is pink and clear, and there's no liaison, and there is no presence of discharge, and your nasal septum is intact and in middle. Next, sir, is I'm going to inspect your frontal sinuses. So I'm going to use a pen light to locate or inspect. And is it okay for you if I touch part of your face? Okay. So I'm going to light up upward under your eyebrow to locate the frontal sinuses. So I will turn on and then here. There. There is Next, sir, is I'm going to inspect your maxillary sinuses and below your eye. So I will touch your face again, and then I will turn on my sunlight now, and then I will place this here. There it is. The presence of the red glow in your sinuses. Maxillary sinuses. That is one. Okay, very nice. The light, the red glow is present in your maxillary sinuses. Next is I'm going to palpate your frontal sinuses and your maxillary sinuses. Is it okay for you, sir, if I touch? Okay, can you tell me if you feel any tenderness while I'm touching your frontal sinuses? Okay? Now I'm going to use my thumb and palpating your frontal sinuses. Do you feel any tenderness?
No.
What's that? Okay. Next is your maxillary sinuses. I'm going to palpate it using my thumb again. Okay. Do you feel any tenderness?
No.
But that's one.
No.
Now I'm going to check if there's any liaison or anything that is in your sinuses, frontal and axillary. Now, next is I'm going to percusses your frontal and maxillary sinuses, and now I'm going to start with your frontal sinuses. Do you feel any tenderness?
No.
dapat lahat ng tao ay equal access sa lahat ng opportunities. Kaya kung may problema ka man sa isip o kung paglakad ang ulat ko,
Okay.
basta function
Your
ka,
maxillary
why not?
nerve.
Walang discrimination dito. There's no
Okay, the findings is that there is no presence of liaison or any problem with your skin, and there is no drainage or something that is abnormal that is happening with your frontal and maxillary sinuses. Next is I'm going to inspect your mouth, Sir Ivan. So I'm going to inspect the lips color, condition, liaison, and the odor. So is it okay for you, sir, if I'll touch your lips?
It's okay.
Okay, I have down my gloves on, and now I'm going to start touching your lips. Now I'm going to start inspecting your lips, sir. Okay, I'm going to start with here. Okay. Okay, very nice, sir. Your lips has no sign or presence of liaison, and it is in normal color, which is pink, and it is moist. Next is I'm going to assist you with your teeth, bite, and the oral mucosa and gums. So is it okay for you, sir, if you open your mouth and then close it? Okay, very nice. And then let's open it steady. I will first assist you with your lips na lang. Here. Very moist, and the color of your lips is pink, which is very normal. And can you open your mouth again? And I will check your teeth. And open wide. Okay, open wide, sir. Ivan. Okay, your teeth. Your gums are in white and in red color. Okay. Teeth. The teeth is in normal color, which is pearly whitish. No odor, no presence of liaison, and yeah. Mucosa, oral mucosa is in good condition as well. Everything is in right color and is moist. And your jaw is in right alignment and with no with no division. Okay, can you protrude your lips? And then can you take out your mouth? Ay, tang. Eh, katawa ayo.
Maraming ilong. Inhale.
Ayan, ito.
Inhale.
Digo. Next, sir, is I'm going to inspect your uvula. Can you say ah? Okay. Can you raise it? Okay.
Hindi ako superhero.
Okay, very nice. Okay. Next is I'm going to palpate your tongue, sir. So can you open your mouth and show your tongue? Okay. See? And I'm using a okay.
Alam ko na napakalaki ng epekto nun sa inyo ng reklamo ko. Pero kasi,
And the other side.
ginawa ko na kasi yun dahil hindi ko nakakagaling ang mamatay ng ito.
No, expecting liaison.
Kasi ako, binalaan mo nila ako. They will be
Can you
no
protrude your tongue, sir?
license na makita niyo. Hindi sa kasuhan kami can always settle for civil damages. But like I said, in case don't worry.
Okay, sir.
I'll do it
And I'm going to palpate if there is any tenderness that is present in your neck, okay? Okay. You feel any tenderness? Pain? No? Okay, very good.
Ang gano'n kasi
Next is I'm going to palpate some of your glands. So first I'm going to palpate your carotid gland, which is located in front of your ears. Do you feel any tenderness, pain? Okay. Next is I'm going to palpate your submandibular under your mandible. Do you feel any tenderness, pain? Next is I'm going to palpate your sublingual under your mandible. Here. Any tenderness? Next is we're going to test the strength of your tongue. And can you, I'm going to force my hand or my finger in your cheek, and then can you push it using your tongue? Okay. Ay, bunga mo.
Ako na rin.
Okay, very nice. The other side. Okay, very good. Thank you, sir. Next, sir, is the gag reflex. Can you open your mouth and show your, okay? So that is all for today's assessment, sir, for the nose, mouth, and sinuses assessment. Thank you for cooperating, Mr. Aizen. Until next time. After the assessment, I will wash my hand and then record and then report.